Barkha, it's great to speak to you again. Last time you painted such a vivid picture for us of what it was like in India's cities. This time you've been looking at what's happening in India's rural areas there in Uttar Pradesh. What can you tell us?
Julie, thank you for bringing me back, and it's really important that your audience and the audience everywhere understands that we are now in a situation where the COVID fires have lit, quite literally, the hinterland of India. When we were talking the last time, we were talking about cities where the healthcare system was besieged by the absence of oxygen, by the shortage of beds, by people dying on the streets, even of the capital, outside closed doors of major private and government hospitals. Now, as I travel into India's most populous state, Uttar Pradesh, and I'm in Lucknow right now, I've traveled through small towns and villages, and what we're really seeing is these horrifying images coming from all around us, where we've actually seen bodies, unidentified bodies. We don't even know if they were ever tested for COVID, floating in the rivers of our hinterland, of our interior villages, raising the question as to whether our COVID dead will even ever be fully counted. We know from our own reporting from cremation grounds and burial grounds that there's a factor of at least 4, a difference between what the official numbers are reporting and what the actual pyres burning at these grounds are showing. And now you couple them with these kind of bodies floating in the rivers, and you really have to ask yourself, are we ever going to even really know how many people are dying, or are India's COVID dead going to remain the great uncounted? Coupled with this, of course, is that in small villages that I've been traveling through, there are no testing facilities, and families are having to, cobble together the little savings they have, get into sometimes little cycle rickshaws, drive to the the closest primary care center, and then look around for how they might even get a COVID test. Testing facilities virtually do not exist in these villages, leave alone treatment. So I think what we're really looking at is these fires shifting now from the cities into the interiors, into the villages, where they may remain the great untold story, though we're doing our best on the ground to bring these stories to the world.
Barkha, how do you think India's ever going to really get on top with this situation if it simply isn't recording the number of deaths and isn't able to test properly? It feels as if they're fighting this terrible crisis with both hands tied behind its back.
I absolutely agree. And as a citizen, it really bothers me that we may not even own our dead. And I'm disturbed by the absence of attempt at truth-telling in the chronicling of these deaths, Julie. And what has been particularly disturbing to me as a journalist on the road is that there has been sort of organized pushback by many supporters of the government online to call journalists like ourselves who are on the road vultures. That word has been used for us because we are going into these areas where the pyres are being burnt, where the graves are being dug, where the bodies are floating in the rivers, and we're being accused, of glorifying the dead. In fact, it's quite the opposite happening. Our poorest people are not being recorded; their fatalities are not being recorded, and that's what we're trying to do. And I've been speaking to experts on the ground here, and many modelers who are working on Indian data actually believe that 1.2 million Indians are already dead. Others are projecting another additional million deaths by June. That's the scale of calamity we're talking about. And yet our official figures continue to hover a little over 4,000 a day. So that's how off we are between the official data and what we're seeing on the ground. And instead of focusing on saving lives, or at least chronicling and acknowledging the dead, we're actually seeing a government that is unfortunately fixated on how the Western media is looking at it. We're unfortunately seeing trolling of journalists who are actually going out to tell these stories. So I really think that there's an absence of prioritization and an absence of focus on the lives of people and more of a focus on image building at this time, which is really very tragic.
There has been some more positive news coming out of the cities from what we've been learning on the ground there, Barkha. What needs to happen now fast in the rural areas where you are? Is there any sign of things starting to shift?
Well, I think the cities, you're right, are showing some signs, some cities, not all. And I think we've all been chastened by the early triumphalism that India showed, right after the first wave. So I would be very careful even to say that it's all, the worst is over in the cities. But yes, some of the big cities are showing signs of peaking and plateauing. But in the rural areas of the kind that I've been traveling through, this fire is only just beginning to simmer. And I fear that it will really boil over in the next few weeks. And what we are urging, the government, and we haven't had any response on this so far, is for the military to step in to build field hospitals, to build giant jumbo facilities where, at the borders of major cities, villages can converge to, maybe send people to. And we're not seeing any of those kind of giant, big tented jumbo facilities of the kind that rural India really needs. And the real fear, Julie, is that even as the cities peak and plateau, as these fires spread into our villages, as COVID spread into India's hinterland, will it remain the great untold tragedy of our times, both in terms of deaths and the cases themselves?
OK, Barkha, and we know too that you've just got over having COVID yourself, so we're very grateful that you've been able to speak to us again, and I know you'll keep us updated with everything that you see in your reporting too. Thank you very much indeed again for joining us, Barkha Dutt.
Thank you for having me, Julie.